Hi. So today is my 14th day after getting my wisdom teeth extracted, and from my previous video and the number of views that I got on my previous video, I realized that that was the most number of views that I got on my channel, and it was on wisdom teeth. And that explains a lot because I think a lot of people search about wisdom teeth removal, aftercare, care before going into the surgery and everything. And being me, I am a very nervous person, and I look for a lot of information for months, for months on the internet, and I gathered a lot of information from different sources, and also integrated what my oral surgeon, actually the real information that I got from him as my care package, and put everything together and did my self-care. My husband also cared a lot for me, but I also transferred a lot of the information that I had gathered from the internet to him. Now, thankfully, a lot of information is available online, which makes things much easier and tells us what exactly to anticipate. But I also realized that different websites or different videos have different kinds of information, and to put them together, it's a bit confusing. It's not as straightforward, and not all the websites kind of give every information that we would want. So that's why I thought of putting together this video. It may be a bit long because I'm going to talk about what all I did before the surgery, what to expect for during the surgery, and what to expect after, and how to do the aftercare, and what to actually expect after the surgery. And if you see my previous video, you've seen that I've kind of tried to record day by day progress of my recovery process, starting from the day I had the surgery. So progress in the sense the second and third day were pretty bad, and the first day was pretty bad too, but with painkillers you can manage things. So I'll get back to all of that. But yeah, if you go back to my previous video, I could not record a lot on those days when I was peaking in the swelling and everything, but you'll get a general idea of how swollen I was. Now, to start my journey with this wisdom teeth extraction whole procedure, and when I was told that I have to do this and everything, this actually starts 10 years ago when I was actually in India. So I was first told about the fact that my wisdom teeth are coming in 2011. That is when I first had my wisdom teeth pain. And before that, I'd also done about 7 root canals from my doctor in Calcutta in India, and he was very good, and he took a lot of care and did a lot of those, like 7 root canals took a lot of time, and he did it very well. And he told me that my wisdom teeth were coming in, and they might start hurting after a certain point, so I should try to remove them as soon as possible. So I was okay with that, and that around that time it was not that severe. The teeth were small, so I didn't pay much attention to it. But the next year in 2012, again it started hurting. So then I went to the doctor again, and he said that I have to do a general anesthesia. I need to go in for a general anesthesia wisdom teeth extraction surgery, and the recovery for that would be about 10 days, which I pretty much had even this time. But I could not do it that time because I was actually leaving for my masters to the UK. So I've done my masters from the UK, and this thing happened exactly about a week before my flight, and I could not have moved my flight because my course was starting just in another week of me arriving there. So it was pretty much at the juncture of a big transition in my life. And because the doctor said it would take 10 days, and my father was worried that in case after 10 days when I travel, actually not even 10, I was supposed to travel within 7 days, and if I get infected during the journey or something happens, or I get super sick once I get there. I'd be new to the country, I'd know nothing, and it would be too difficult for me. So we decided to wait on it a little bit. And my other doctors, who we also consulted back then, back in India, they also said that yeah, I could probably wait for a couple of more years and then go back and do it. But what happened is, after I went back to India from the UK, the pain completely disappeared. I had no problem. I completely forgot about this whole situation, and I had no problem at all. I went to Bangalore, I was working, the pain never came back. The pain actually came back when I came to the US, and the first winter that I experienced here. And it was not super terrible, but it was there, and I had an antibiotic or something. Actually, that time I didn't even have an antibiotic. I just did mouth washes with Listerine or something, and it was fine. So then I was okay with it, forgot about it. The next winter also, again, it was irritating a little bit, and again I did that mouthwash thing and it was fine. I guess every time food went and got caught in those teeth in that juncture, it hurt, and every time I mouth washed, things got better because that food probably came out. So the infection subsided on its own. But then in 2020, just before the lockdown was announced with the pandemic, again I saw a dentist here, and they said that this is going to go for a major surgery because the roots of these lower teeth had really grown very long, and they were coming out horizontally, which is not rare. A lot of people, in fact everybody that I've spoken to, has had like horizontally growing wisdom teeth. So it literally, instead of growing like this, they came out like this. So the hole would be pretty big, and the upper two were fine. They were not that problematic. And the only problem is that the upper teeth's root, the teeth for the upper roots were into my sinuses. So even this time when I was getting it removed, my surgeon had said that there's a possibility that there could be a rupture in my sinuses. So if I by chance bleed from my nose, that would mean that there's a connection between the nose and the teeth, and the sinus has ruptured. So then I'd have to go back for another procedure for him to put it together, but that didn't happen, touch wood. So that's that. So here, like right before the pandemic, this whole thing happened, and then the doctor said I'd have to do it, but he gave me antibiotics, and then I was fine. And the next year, again, it hurt, got antibiotics, it got better. And then this time I went to this doctor in last year October to get some of my fillings done, and also to get a couple of my teeth root canaled and crowned. That's when he said that I have to get my wisdom teeth out now, because the lower ones were like really in a very bad condition, and there was a high chance of getting another infection and maybe cavities too later in future if I don't take it out now. And usually toothache start at very odd times, and then they are very unbearable, and they just shoot to some very horrible extents that you cannot control them. So all my teeth were in that condition, so they were on the brink of becoming very, very troublesome. But it did not happen because I took the right step at the right time. So I started contacting a lot of oral surgeons to kind of check with my insurance, check with my dental coverage. I actually have an access card called that's something that you get here in the US. It's called Aetna Access Card. It's almost like a discount card. So I bought it with a certain amount, and then because I have that, that company also pays a bit of some portion of the whole amount, and that really helped me to a great extent. So I had my dental insurance, this dental access card, my medical health insurance from my university, and I also got an award for getting treated. So I was reaching out to many oral surgeons and seeing what kind of reviews they have on Google, and I also asked around people in my university, because I'm sure a lot of people have gone through this surgery and they have some kind of experience to share about whichever doctor. Now the funny thing is, the one doctor who was really close to my apartment, had amazing reviews on Google. All my friends said very good things. Even some of my professors in my department also said excellent things about the doctor. And I really, really wanted to do it from him. And then the day I call him, he's like, "Oh, I just retired yesterday. You're a bit late, so we cannot do it. You'll have to find another doctor." So I was very sad, and I was also very worried because that way it was constantly getting delayed and delayed. And I also tried a couple of doctors in DC and Maryland, but it looked like they were all full for many, many months. Like I'd have to wait for 3 or 4 more months. And I also tried the NIH, that's the National Institute of Health in Washington, DC. It's in Bethesda actually. But they were completely packed, and they were like, "You're in a long wait list, like 500 plus." So I was like, okay, I need to find somebody else. And then I asked another friend of mine, and also if you do a quick Google search, like the best oral surgeon in Delaware, you will get Dr. Nogu, and he definitely is one of the best. I think I've not been to other oral surgeons, thank you, touch wood, but Dr. Nogu was very nice, very kind, very gentle. And the best thing about Dr. Nogu was that, so like I said, I did a lot of research about this whole thing, right? And one thing is that I found out that there's something called PRF treatment that is done to wisdom teeth removal surgery patients. PRF stands for Platelet-Rich Fibrin treatment. If you Google it or search on YouTube, you'll get a lot of information about it. So what it does essentially is, so basically when you get your teeth removed, the healing primarily depends on how your blood is clotting in those sockets. So imagine when you get a cut in your hand or somewhere else, blood clots over there, you see a dark maroon scab, right, that develops. That scab kind of protects that wound, the underlying wound, while it's healing, so that the other environmental factors don't go and attack it or cause infection. So if you scratch the scab, it hurts, so sometimes people even get septic from it. So that scab is very important to protect you from any external environmental sources or infections. Similarly, for teeth surgery also, or any other surgery, I think for teeth surgery especially, when the tooth is removed from the socket, you get big holes, and that hole is filled up by your own blood, and your blood has capacity to clot, right? So the platelets in human blood, that's the thrombocytes. I've been a very good biology student before, so I know this scientific word, but it's pretty common. I mean, I think class 8 biology has this. So thrombocytes, blood platelets, they help in clotting. So they clot over that wound from where the tooth has been taken out, and that blood clot protects and heals the gum eventually, and also serves as the source material for the bone to grow back over there. Because in my case, they drilled out the tooth from there, all the teeth actually. So from this part, so the jawbone has holes in it, so the bone material has to grow back in it, right? So this blood clot that forms there, it kind of helps the bone to grow back in those holes. So it is very, very important to have the blood clot form properly. And I was afraid, because I've read that many people, sometimes this is rare, not that rare, like it's 5%, there's a 5% possibility. And sometimes when that blood clot doesn't form, either it disintegrates before time, or it doesn't form at all, or there are several reasons why that happens. I'll come to that later. But when the blood clot has some kind of issue, then your healing won't be normal, it won't proceed in the expected way, and it causes a lot of pain also. So I was very afraid that maybe that will happen to me, because I don't know, I always expect the worst. I mean, I just want to anticipate problems and be prepared for them, which kind of helps me in many ways. I mean, this is something that I've learned in my research journey so far. We anticipate problems so we can handle them better. Okay, so I got a phone call, so the video got disrupted, but Sorry for the interruption. But yeah, so that blood kind of helps in clotting and healing the wound, and the faster that happens, the better it is. Now, because I had read that sometimes it doesn't happen, I also searched whether there are ways to prevent that situation. And I did find that, and that is called platelet-rich fibrin treatment, which is the PRF that I was talking about. So what this does is that before your surgery begins, your doctor kind of draws out some blood from you and makes a centrifuge out of it. So this a centrifuge is just like rotating the thing very fast in a separate container outside your body, like outside in some external vessel, or in their machine. They have centrifuge machines, and that kind of clots the blood out, like artificially. It doesn't happen naturally inside your mouth, but it happens artificially. They put it in a test tube and they use that blood clot after they are done with the extraction. So what they do is they remove your teeth, and then they take the clot that they've created. It's a bit like jelly, and they put it inside the sockets, and then they stitch the gums on top of it. So this ensures that there is definitely a blood clot, and it ensures that your healing will be in time. And apparently I've heard that healing is faster, because apparently so if your body is doing its job on its own, it takes a bit of time to get it to have things going naturally. So apparently I've seen this in some videos where doctors say that the patients who came in a week after, like the patients who got this PRF treatment, who came in a week after the surgery, they saw that the gums almost looked like it's been healing for 2 weeks, where the normal patients healing process takes a bit longer. So apparently that is the success rate of PRF. So I was like, okay, then maybe I'll look for it, whichever doctor does it. And that really good doctor that all my friends recommended, or even the professors talked about, or even he also had very good Google reviews. The one who retired, he used to do it, and he does it routinely. But unfortunately, I didn't get him because he retired. So I was looking for other doctors, and when I went to my doctor, the one I told you about, Dr. Nogu, he was so nice. When I was really nervous, I asked him that, do you do the PRF treatment? I've heard that many people do it and it's got good results. He told me that you are a healthy girl, Shri. You're young and healthy, and your body will do the work, and you will be fine. There's nothing to worry about. And truly, there was nothing to worry about. My body did the work, but at that point I felt so relieved that he thought that I'm doing well and I'm healthy and I don't have any bad habits. And the funny thing is, the day I went for my first consultation, they didn't do any extra tests, like blood tests, this and that. They didn't do it. Like, I know in India they do blood tests to check the coagulation rate, of the capacity to clot your blood, how well you're doing that way. So they do it. I guess many other countries do it too, I don't know. But I know in India they do it, because a friend of mine also did this surgery recently, and she said that they wanted to test the clotting time of the blood. But he didn't do any of that for me, and he was so confident that I am healthy, because the only two things they kept asking me: if I drink or smoke. If you drink or smoke, complications increase later. But if you have a good lifestyle, I don't drink or smoke, I work out every day, I eat well, I eat a lot of greens and colorful vegetables and fruits and protein. So he was like, yeah, you are in very healthy shape. And I was like, okay, don't jinx it, I hope I am. And indeed I was. I mean, of course recovery takes time. Any surgery has its own pains, but it was pretty much it, like, my experience was pretty much the same as what I heard from my friends who did the surgery at a younger age. So this is something I must mention, that my Indian doctors also had told this to me, and also my American doctors and several other websites say this, that before the age of 25 our jawbone is less dense, so the recovery is faster after this surgery, because when the teeth are pulled out from the jawbone, if the jawbone is very dense, which it usually is after we are 25, it takes longer to heal and it's more painful. You kind of go through a lot of pain, like during the recovery, for a prolonged period. So they said that it takes much longer to recover if you're over 25, and I am over 25. And I was very worried that, oh my god, I don't know, my friends, like some of my friends who did it at the age of 21 or 22, they said it took 10 days for them to get better, and I think I got better at 10 days. And you saw my video, I think I was doing pretty well even on day 7 and 8. And today is my 14th day. Of course, I do feel something is there here. It's not like completely like the way it was before, but I know it kept getting better and better over each passing day. So, and I'm also eating everything now. I mean, I also checked online. They said from the 14th day you can give yourself permission to eat everything normally. So I had like a sandwich in the morning for breakfast with egg and hummus and a lot of spinach, kale, everything that I eat normally. And I also had salmon yesterday. I've been eating salmon for a few days now, and I'd say I started having semi-solids from my day 4. I mentioned before I had avocado and mashed potatoes, but they were not absolutely smoothied in in that sense. So I'll tell you what I did for my going into my surgery, like preparation before the surgery. So one is that I saw a lot of videos and checked out many websites about how to take care of myself after the surgery. That's the most important preparation that you need to take, is that you need to know that you have to survive on liquid and soft food for almost 7 days. Like, take it as 7 days. If you get better sooner, nothing like it, but just as an anticipatory preparation, prepare for 7 days. There's nothing bad in preparing for worse, but good things are most welcome all the time. So I also noticed that most soft foods and liquid, mushy food and everything, most of them are sweet. And you've seen in my previous video that I didn't want to live on sweet food for too long, and I wanted liquid but savory and healthy food. So I made these spinach and kale shakes. And spinach shake is pretty much like, I don't know if you're aware of this Indian dish called palak paneer or saag paneer or saag chicken. In these things, they blend the spinach in a certain way that it's very smooth. It doesn't have anything gritty or anything that can get stuck in your teeth. It's very smooth. It almost looks like velvety smooth when you cook it. So that without the paneer or chicken or anything. So before you put in the paneer, you make the gravy, right? So this is just the gravy. So it has a lot of yummy things. It's savory. You put all your nice turmeric and a little bit of ginger and all these spices. They, by the way, the dentist will ask you not to eat anything spicy. So do not put any spices that can irritate you. And also these things are turmeric and ginger should be very little, just for very slight flavor, in a way that it just blends with the liquid completely and thoroughly. It should not be like paste. You can't put ginger garlic paste in it. No, it's not that. This is just powdered, little bit of turmeric, very little bit of ginger, so that it completely blends, just like salt would blend into the liquid. So it's almost like that. And I prepared that, kept it in a bowl, and I used to put it in a cup and drink it. For breakfast also, I used banana and something called as chatu in Bengali. Chatu is basically powdered lentils. Uh, I'm not sure if it's lentil. It's something like chickpea but powdered. And in Hindi, I think it's called sattu. And if you go to any Indian store, you might look for sattu. That's the spelling of the word. And it is basically a tasteless powder. It's basically, if you powder chickpea, it it would have nothing, no taste, right? So this is something similar. It's made of, it looks like flour, but it's not really flour. It's made with ground pulses. And I used to drink this as a child before going to school. It's got a lot of protein. That's what they say, because pulses and legumes have a lot of protein, right? So this has a lot of protein. So I assumed that it would help me heal faster, because it's not just sugar. So I put I taught this recipe to Anupam. He put half a banana, 2 tablespoons of this chatu, and half a glass of lactate. So I'm lactose intolerant, so I don't drink regular milk, but I drink fortified lactate milk, and he poured like half a glass, sometimes half a cup of milk, and that also looks like a really yummy smoothie. And I just drank it all. Like, for the first 2 days, I could not even have things like pudding or scrambled eggs or mashed potatoes, because I just couldn't open my mouth at all. It hurt a lot to open it. And also it felt like something is like stapled, like my back is stapled, the back of my mouth is stapled somehow, that I can't open it. But it was fine, because these things are very nutritious. I was getting very good nourishment, and I was not feeling hungry for long hours. Actually, I could just go on like as if I had a regular meal. The first day though, after coming out of surgery, I did have a spoon and a little bit of pudding just to have the medicine, but I'll come back to that later. So yeah, I made these preparations the night before the surgery, as you've already seen in the previous video. So I put them in bottles and and put them in the fridge, so they were ready. And on the day of the surgery, my surgery was at 8 a.m. and I left from home at 7:25, 30ish. My friend came. My husband was also with me. So my friend was driving, and my husband was there to pick up the information and the aftercare instructions. And he had to be there because he would be the one taking care of me while I recovered. So both of them went together. And also, like, if I'm sitting at the back after the surgery, I'd need somebody to sit with me. So my friend went so that she could drive. And once we reached the hospital, I think I was pretty chill, because I knew what to expect. I was not nervous at all. And I just filled up all the declaration forms, and that, like, you have to sign a lot of forms to give consent. And also my husband and my friend had to sign that they'll be with me, take care of me, and somebody will drive me home and stuff like that. And then I gave it, and then we were waiting, and the nurse called me, and I just went in general. I didn't think much. They just called me. I just got up and went, and my husband was like, I thought you'll be worried or you'll cry or anything. You were pretty chill. You just got up and went. I was like, yeah, I mean, I don't know, I was probably thinking about something else, and they just called my name. I just walked in. And then when I was sitting on the chair, they were getting me ready with the oxygen in my nose, and they made the IV channel. They actually tried the IV channel in my left hand first. So so the oxygen and everything was, and the ECG machine, so all of that was done by the nurses, and the doctor came and did the IV channel. And my doctor was like, oh, your veins are so tiny, Shri. And I'm like, yeah, I guess I'm a very tiny person. So he tried on my left hand here and then here. My hand is still a little green from it. They couldn't do it in these two. My veins are not sturdy enough to take in this hand probably. And then he went to this hand. See, there's no mark here because his vein is so good. It just popped up the moment he touched it. And he was like, oh, I should have gone for this one first. And then he put it and then they put another mask on me, and then they asked me to bite on something so that my mouth is open. And then he was like, oh, tell me something about your study, your research. And the moment I started saying, I think I fell asleep. And the next thing I remember was like the doctor asking me, Shri, are you awake, are you awake? And I was like, yeah, I am. And then I was like, I am awake, but I could use a few more hours of sleep because I've been so like anxious, and it's been busy this summer. I mean, I've been submitting so many abstracts to different conferences and stuff. So I was like, yeah, I was feeling so nice and happy while sleeping. And I remember I even dreamt about shopping around on the Fifth Avenue for some reason. Maybe because I went to New York a few days ago. But yeah, and then the nurse asked me to go and sit on the wheelchair, and then they wheeled me out. And then I saw Mackenzie and Anupam downstairs, and then Anupam says I was very drowsy and like half asleep, half awake. And when they asked me to go and sit in the car, I was walking in another direction, and then they were like, no, Shri, it's this side. And then they turned me around and made me sit in the right place. And Anupam was like, once you sat down very smartly, you were half asleep, and then you put the seatbelt. I think I was like coming out of the anesthesia, but I was not completely out, so I kept like becoming really aware, and then again sleepy, and then again very aware, and then sleepy. So when I sat in the car, I was like, I'm sitting in a car, why am I not wearing my seatbelt? And then I put my seatbelt, and then it was a smooth ride. And once we reached my room, my apartment is upstairs, it's not on the first floor. So we walked up, Mackenzie helped me a bit, and then I just went and sat on the bed, and I was like, I'm going to sit here and not move, because I was very aware by then that I have to make my blood clot form. And I was just sitting there for the next 1 hour, and then Anupam said that I need to have the antibiotic and the painkiller at 10 o'clock. So that's when he removed my gauze for the first time. And when he removed it, it was soaked in blood. It was so much blood. It looked like there's some warfare going on inside my mouth. And then then I had that little bit of pudding and had the antibiotic and the painkiller. And then he put a new set of gauze, and then again after an hour he changed it. And that way we kept changing 6 times. So I think the last time I changed my gauze was at 4 p.m. and that too by holding on to that last gauze for like 45 minutes or something. And when it came out, it was not drenched in blood, so I knew, okay, so that means my bleeding has stopped, clots are forming, that's good, that's really, really good. And I don't want to jeopardize anything, so I just wanted to stay there and be calm and just let my teeth do the work. And then I just drank some juice. I had mango juice, lychee juice, and all of that helped me. For that day, I just drank juice, sat on the bed, watched a lot of movies. We watched 3 movies. We watched When Harry Met Sally, we watched Bridget Jones, and we also watched The Holiday. So we kept watching these rom-coms. And the next day we also watched Sleepless in Seattle. The next day was also painful. And the second day is when the swelling actually started coming. So that night you have to sleep upright. You cannot lay flat on your back. So that whole night I had 3 pillows on my back, and I just slept sitting. But at some point at night I had turned left, so my left side was way more swollen than my right side. But I had to have a lot of painkillers. I had to wake up in the middle of the night and have painkillers. It was quite painful that day without the painkiller. But with the painkiller, it's fine. But you kind of have to be careful, because when you have the painkiller, it feels like there's nothing and you feel just normal. And then you might want to get up and do things. But do not do that, because the blood clot really needs to settle down properly. And for the first 72 hours, it's a very crucial time. So you still have a risk factor until this place is completely healed. So for the first 36 hours I iced myself. I had read that after 36 hours ice is not helpful, so then you have to start putting a moist warm compress. So for the first 36 hours I held ice. I actually had a whole band which would hold the ice next to my cheek, and so that I don't have to hold it all the time. So I wore that and watched all those movies for all those 36 hours, and then I started putting warm compress. I think I was more diligent with the cold compress than the warm compress. So my swelling took a bit of time to go down, but the cold really helped. But I'd say one thing, on the first night I had a very sore throat because I was told that when teeth are taken out, the muscles around this area get a bit disturbed. So it is possible that you might have trouble swallowing. That's what I had. It almost felt like having an infected tonsil, like you're about to catch a cold or something. So that happened, but the painkiller helped with that as well. And then for the next 24 hours I put a warm compress, and I kept putting it. And then we watched a lot of other movies, like I said, Sleepless in Seattle. I was also lucky that on my third day, Never Have I Ever came out on Netflix, and Anupam and I really like watching it. It's a fun show. So we watched all of that on that Friday. First, second, third, yeah, on the Friday, and it was really good. And from the third day, I actually started getting up and walking a little bit in my room, and I washed my own spoon or cups or something like that. I didn't do major utensil washing or anything, but just the spoons and cups and stuff. And then every afternoon, so on the third day, I actually didn't have painkiller for a long time. I think I went 18 hours without a painkiller, and I just wanted to check, like, how does it get really bad. And then on the third day in the afternoon, I had my first painkiller, not in the morning. And then I had a painkiller at night too, because I wanted good sleep at night. On fourth day also, I had 2 painkillers throughout the day. And also on the fifth day, a little bit of avocado got stuck in my stitches. So that's why it was hurting a little bit. So I had another painkiller on the fifth day too. On the third day, I think, on my fourth day, one of my stitches came out. I could feel it, so I just took it out. The other stitches had dissolved. This was just the lower left one, and that was fine. Then the doctor said that if a stitch comes off, it's not a big problem. That was that. And so I think I diligently had painkillers until day 5, I think 2 a day. The first 2 days I had 3 a day. 3 each day, and the next few days I had 2 per day. And on the 6th day, I actually came to Maryland from Newark, and I thought it would be a long journey. It takes just 1.5 hours, but from home to train and all of that, it takes a bit of time. So I had a painkiller for that, and I brought my painkillers here as well, just in case. And yeah, that was that. And on the 7th day, you saw that I was almost okay. I had my last antibiotics, the 3 antibiotics for the day. And the most important thing, I think, that helped me after the whole extraction was that from the 2nd day, I started rinsing my mouth with chlorhexidine. And that is a very strong mouthwash that they give. It's antibacterial, and they ask you to start rinsing with it from the 2nd day. Well, actually they ask you to use a syringe inside your mouth to irrigate the socket, because the socket starts closing at that time, and if food gets stuck there, then the gum tissue will form on top of the food item. That will be bad, because after a couple of days, when the food starts rotting over there, it will cause infection, and then you again have to go to the doctor, and the doctor will have to drain that place and stitch again, and you'll be on another round of antibiotics, which is a whole lot of other trouble. So I was actually asked to do that syringing and that irrigation from the 2nd day itself, but I just couldn't open my mouth on the 2nd day, so I just did normal rinsing. But I was not eating as such. The 2nd day I just had some ice cream and mango juice that couldn't have gotten stuck here. So I was like, okay, I'll just rinse and keep my mouth clean for hygiene purposes. And that was okay. I hope I really hope I fingers crossed and touch wood that nothing is there. And from the 2nd day, Anupam started doing syringing, and that was very helpful, because every time he did that, I saw that little debris came out. So I hope, and I think everything is okay over there. But I did use the mouthwash up until like day before yesterday because it was really good. Every time I used it, my mouth felt very clean and proper. It's almost like brushing your teeth. And I think I also felt that the mouthwash kind of helped dry up the wound, because before that it felt very tender and soft. I don't know, maybe it would have dried up on its own, but I feel that ever since I started using the chlorhexidine mouthwash, it started feeling a bit tighter and as if it's drying and healing more. But I don't know. And also in America, they ask you to start your normal toothbrush regimen from the second day. I did not brush on the second day. Maybe I should have, but I was too scared and I just couldn't open my mouth. But I started brushing my teeth from the third day. Not in the extraction sites, but this front part. And now, actually, from the last 2 or 3 days, so after my 10th day, I'm actually brushing all over. I wouldn't say that my sockets are completely healed, but I think there is something, but I am brushing very gently to make sure that everything is clean. And I'm also flossing, and I started actually flossing from the second day itself. Even though I didn't brush, I did floss, so that was good. Yeah, and then one thing I'd say is that many people are afraid to get this done at an older age, like they said, post 25. And even in my previous video, somebody commented that they're 28 and they're afraid to get this done. I'd say my friends who did it at a younger age, at pre 25, also had similar kind of experience as me. So if you are healthy and doing well physically in other aspects, I think it won't be that bad, and you have to follow the instructions to the T. Make sure you do not misunderstand the instructions. It's a long instruction list and you have to follow it very carefully. I had actually requested my doctor to send my medications to my pharmacy the night before, because I knew it might be a bit too rushed on the day of the surgery, because a lot of people who get their wisdom teeth removed here, they pick up the medicine on the way back home from the surgeon's office. But I thought that would be a bit of a hassle. I mean, what if I get late and the pain is unbearable or something? So I decided to take the medicine the night before and started having it exactly on time when I was asked to have it. And yeah, so the healing, I'm sure if you get it done at 16, 17 years of age, is probably faster. I have seen videos of people who looked like nothing happened. They were fine from the second day itself. Great, that's really good, but it's not true for every 16, 17-year-old. I've also seen 16, 17-year-olds who have gone through the same kind of discomfort as me. So I guess as long as you follow instructions, your doctor is good, and everything is followed the way science asks us to, we have a lot of reason to believe in science and in our bodies. And of course, you have grace and a lot of blessings and good wishes from your loved ones, so you will get better. So this was a lot of information from my experience. Other people might have different experiences, but I think when a medical procedure is to be done, it's best to trust your doctor, do your own research, find a good doctor, of course. And most doctors want to do a good job, right? Complications happen for different reasons sometimes, but everybody wants to do a good job, and everybody has brains to think, so you know what you're doing is right or wrong. You can make your own decisions. Of course, like all these medical instructions say that do not take unsolicited advice from people who have good intentions. So take your own decisions, make informed decisions, talk to professionals. If you have friends who are dentists or oral surgeons, you can talk to them. Most of us have some scientific knowledge, whether you've done it in middle school or high school or even college. All of that helps. So everything is logical. Follow your own logical understanding and take care of yourself the way the instructions ask you to, or the doctor asks you to, just follow the instructions to the T as much as you can. And that is all. I hope this helps. So one other thing I'll add is that a wisdom teeth extraction is really different from extraction of other teeth, because wisdom teeth are really far behind in the mouth, and that's the place where a lot of nerve endings are situated. So your nerve that serves your lingual, under your tongue for your sensation and your speech, nerves that go up to your eye, nerves that serve your ears, and also like really it's very close to the brain. So that is why it's considered a very important it is a complex surgery, and in India actually this surgery is considered as a head surgery. So it's very very different from a regular tooth extraction. So please take it seriously, and also, do not laugh at people who are getting this surgery done, saying that this is just a tooth extraction, so why are you so nervous about it? Because it actually is very serious. Complications do happen, but you have to be careful. If you're careful, you'll be fine. It's smooth, it's not that scary. I know I was very scared, but I don't think I had to be. I mean, even the general anesthesia where I completely went to sleep, it was nothing. It's just like I'm talking now, and next second I'm sleeping. I don't even know the whole thing, when the whole thing will be done, and it actually is done very quickly, and they do it really really well. At least Dr. Nogu did for me. So yeah, it is a serious surgery, and please, if you are going to get it, take it seriously, because I've heard of people who just got out of the surgery, and when anesthesia was still there, they were like, oh, it doesn't hurt, it doesn't pain, let me just go about doing my housework or anything else. And then they ended up getting a dry socket. A dry socket, by the way, is that condition where the blood clot doesn't form, and your bone and the nerves underneath get exposed to your food, air, water, drink, whatever you have, and the pain is excruciating. People who've had it, it actually they've ranked it something like 15 on 10, the pain level. So trust me, it actually is very painful if you get it. So try not to get it, and it also delays healing by a lot of time, maybe 2 weeks more. So it took me almost 2 weeks to get better, and then again 2 more weeks. It's complete hell. So you do not want that. So take it seriously and heal properly and successfully. So all the best.